India's deadly COVID-19 second wave is an eye-opener. Lulled into a false sense of security following decreasing number of cases and vaccination efforts, people let their guards down. Which is why early intervention through testing remains a very important piece in the overall strategy to defeat the pandemic. Without adequate testing, people who test positive will not isolate and the circle of transmission becomes wider and wider. That means an increasing number of infected individuals. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines, where your healthcare comes first. India thought they had conquered the virus, which is why some of those who might have sought for a COVID-19 test have abandoned that option. Joining us in today's discussion are Dr. Eileen Espina. She's a public health physician and member of the COVID-19 Technical Working Group on Unified Algorithm. Also with us is Dr. Maria Rona Bergantin. She's an infectious disease specialist at the UST Hospital. Thank you both for joining us here today. Now, the unfavorable situation in India is a warning to all that the COVID-19 pandemic is far from over. And despite vaccination initiatives, majority of us in the country are still not protected, which means testing remains a crucial tool in managing the COVID-19 threat. Now, Dr. Rona, your thoughts on this and your advice to our viewers.
With regards to the testing, so definitely I will have to agree with you that part of the things that we need to implement at this point in time is still expanded testing, simply because we have many layers with regards to the prevention of the spread of respiratory viruses. And I think Dr. Eileen will agree with me whenever we quote the use of the Swiss cheese model in the prevention of respiratory viruses. So not a single slice will be able to prevent the spread of the virus, but when you use this multiple slices, you're going to increase the risk of prevention of the viruses.
Now let's get one thing straight. Vaccination is effective for individuals, but it doesn't stop one from getting mild or asymptomatic infections that could set off a chain reaction of infection to others. Now, Dr. Rona, explain this process to us. What happens to the body when someone is vaccinated, and how does that help in fighting COVID-19? Let's start first, Dr. Rona, with one person who is jabbed or vaccinated with their first dose, as opposed to having a complete two-dose vaccination.
When a person is vaccinated, this means receiving the antigen. So the person receives either a portion of the virus or the virus which is already killed. And this virus, once it enters the body, or that segment of the virus which enters the body, now signals our immune system to create antibodies. So we have to correct the notion that when one is vaccinated, a person can get COVID, because again, as I have mentioned earlier on, the vaccines that we are using are only part of the virus, or those viruses which are already killed. So they cannot increase in number in the body, and then they really cannot cause infection. Now, once the body recognizes the presence of these antigen, the immune system will now be asked to create antibodies. And these antibodies will now circulate in our body in such a way that early during the first dose of the vaccine, we now have some levels of protection. So this is just partial, as opposed to when the body again is given a second dose of the vaccine, or probably even in the long run, if let's say booster doses will be needed, the body now will be able to recognize that, hey, I have seen this antigen before, I have seen this virus before, or segment of the virus before. Therefore, the body will now be able to produce more antibodies rapidly, because that is one of the unique characteristics of our immune system.
So we want to go now back to the testing basics. Dr. Eileen, what are some of the types of COVID-19 tests that are available to us right now?
Going to your question, there are at the moment 4 types of COVID tests that we can use. First is the symptom-based test, kung saan it is just dependent on the appearance of symptoms ng isang tao who has exposure to COVID. So maghihintay ka lang ng appearance ng symptom, which we can actually apply on patients who are placed on quarantine. So the second type is what we call as the nucleic acid amplification tests, of which RT-PCR is based, and also the saliva test. So yung nucleic acid amplification test is a type of diagnostic test. Ibig sabihin, ito yung pang-diagnose mo ng COVID, wherein it detects the genetic material of the COVID virus. And in this case, because RNA virus siya, it detects ribonucleic acids or RNA. The other tests are the antigen test, wherein gumagamit din ito ng nasopharyngeal swab or nasal swab. But what is used here is what is the difference with an RT-PCR and an antigen test is that the antigen test will detect the presence of viral antigens, and it will establish the presence of an active or current viral infection. Our HTAC, our DOH HTAC says that for an antigen test to be used, it must have an 80% sensitivity and a 97% specificity. The last test is the antibody test. So ang antibody test uses blood specimen and it detects for the presence of antibodies, yung sinasabi ni Doktora kanina, na napo-form ng katawan natin in reaction to the infection or to the presence of a vaccine.
I'd like to focus on the antigen test as well as the RT-PCR. We can even include the antibody test here as well. Which is the best one to use at any given situation? Like I understand what you mentioned, the RT-PCR is still the gold standard. But in terms of time frame, mas maiksi naman yung antigen test. So when is one better to be used?
The HTAC has released recently yung evidence summary nila for the use of antigen testing. So, of course, we stand by the recommendation that we still prefer an RT-PCR. RT-PCR pa rin talaga yung piniprefer natin na gamitin. But in areas kung saan kulang, kulang ng capacity to perform RT-PCR test, an antigen test can be used. Kasi we have to be judicious in the use of our test. Kasi nga, we want it to be fast, but we also want it to be accurate. Kasi ang isang kinatatakutan natin is that some people, they do the test, and there was this practice that was done, which thankfully naagapan naman, na people on quarantine, they were tested and they thought that if they test negative, it's okay for them to be discharged from quarantine. So parang without completing the 14-day quarantine. So yun yung danger doon.
That's very good for that information because getting tested for COVID-19 can be a bit pricey depending on the test and even uncomfortable for some. But Dr. Rona, should you wait to have the symptoms before you get tested? What are some of the guidelines on this?
The timing of the symptomatology as well as the timing of the test really matters. So hindi porke negative yung test mo, ibig sabihin wala ka na talaga na infection. The test that you get is as good only during the time when you were tested. Okay. So, kailan ba yung talagang maganda na magkaroon ka ng testing? Definitely, once you have the symptoms, that is one of those best times that testing can be done. But again, yung sensitivity ng test natin ng RT-PCR, hindi pa rin ganun kalaki. So, based on wide studies, they have said that 8 days into the symptoms, typically, mas nababawasan yung false negative result. Thereby, that testing can be done even at a later date, yung around 8 days na sinasabi. So, ang tinitingnan pa rin natin, paano kung wala akong sintomas, magpapatest ba ako? Ang lagi po naming ine-emphasize sa publiko, ang unang-unang titingnan po natin ay yung tinatawag natin na 14-day clinical test. Kung saan ang hahanapin natin, meron ba tayong panahon na magkakaroon ng sintomas kasi malalaman naman natin to kung tayo ay na-expose sa isang tao. Bakit tayo kailangan stricto yung 14 days natin? Kasi alam natin, oras na pumasok yung virus sa katawan natin, pwede kang magkaroon ng sintomas sa loob ng 14 na araw. Alinman sa panahon na yon, but on average of 5 days to 6 days based on literature. So hindi safe na nasasabihin na ay wala ako or negative yung test ko earlier on kasi sometimes patients cannot really are asymptomatic or yet pre-symptomatic, negative ang test, tapos sasama sa labas yung pala nagkakalat na rin sila ng virus.
Very important talaga ang timing as well as, but in the general sense, testing, and more testing, which remains a crucial step in the fight against COVID-19. But often, people are terrified with the word swabbing. Some are afraid it would hurt, but it's really not meant to be painful. And there's a way to get yourself prepped before a swab test. More on this when we return. You're watching MedTalk Health Talk on CNN Philippines. A negative COVID-19 test doesn't make us free from the virus. Some tests can miss infections that are still incubating and you can still be infected after taking that test. That's why it's very important on the timing. We're Together in Health. I'm Dr. Freddy Gomez and you're watching MedTalk Health Talk on CNN Philippines. Swab testing doesn't have to be painful. At most, you should feel just a slight discomfort. Dr. Aileen, we want to share some tips on how to avoid any kind of pain or discomfort whenever they go for swabbing. What can you suggest?
You have to make sure that the one collecting the specimen is trained to do it. So there is a training guide for proper specimen collection. No, that's one. Then second is that the patient must be relaxed, in a very relaxed state, and should follow all the instructions that are given to them by the technician or the technologist. So usually, we tell the patient to assume a comfortable sitting position, and then we tell them to tilt their head, about a 70-degree angle. And then pag na-tilt na siya yung head, the technician now will insert flexible shaft or a wire gently into the sa nose natin. So papasok niya yan dahan-dahan at hindi yan aabot dito sa, mararamdaman mo lang yung dapat kung magaling yung yung nagkukolek, parang kiliti lang siya. So parang makikiliti ka. And then it will slowly be rolled out gently. So don't fight the procedure and just follow the instructions made.
Yes, dapat talaga. And the proper knowledge of the anatomy on where the nasopharynx is also very important to the one doing the test. Now, as you mentioned, Dr. Aileen, that no test is perfect and there's a chance that it could yield a false result as well. How can tests go wrong?
Una is the specimen that was collected. So that's why it's very important that we were able to get the proper amount and we were able to swab talaga yung sa where the virus is mostly concentrated. So specimen collection is one of those things. And then as mentioned earlier by my colleague, it's also very important in the day of collection or the timing of the test because we have to make sure that there is enough viral load. And also the cycle threshold, meron din kasing requirement yan kung ano yung cycle threshold the test kit that will also be used. So because of those factors, kaya medyo yung sensitivity ng RT-PCR is hindi siya ganun kataas. That is why for our antigen test, they have to make sure that it's at least 80% sensitive as compared to RT-PCR. Because RT-PCR nga, as mentioned, hindi na rin siya ganun kataas yung kanyang sensitivity to begin with.
Dr. Rona, we want to talk about this time and share with our viewers the concept of a false positive and a false negative result because importante this falls into the correct timing and properly maximizing how a test is done. Could you expound on this, please?
So pag sinabi natin na false positive result, so yung isang tao na wala naman talagang sakit or actually hindi nag-harbor ng virus, nung nagpa-test siya, lumabas na positibo or meron nung element or yung SARS-CoV-2 RNA na nakita doon sa kanyang resulta. But whereas when we say this is false negative, ang ibig sabihin nito, ito yung mga tao na talagang meron naman na virus sa katawan, pero yung test nila, ang naging resulta, negative. So, syempre, may mga ibang factors na nakakaapekto bakit nagpa-false positive. One of that could be contamination from the laboratory. But then, as you have mentioned earlier on, kung false positive man, minsan mas nakakapag-ingat pa yung mga tao kasi alam nila sa sarili nila na, oy, meron akong resulta na ganito, positibo, hindi na ako makikihalubilo sa maraming tao. Pero doon sa mga false negative na mga resulta natin, ito yung medyo nakakatakot kasi kampante ka sa pagkakaalam mo, ay wala akong sakit eh. Sa test ko, negatibo. Kaya pwede akong makihalo sa tao pa rin. So that's why tests need to be interpreted cautiously, definitely, because if the person has signs and symptoms and there is really an ongoing transmission, sinasabihan namin yung mga pasyente na kahit negatibo yung test mo, huwag mong ipagpalagay o ipagkakampante yung sarili mo na wala kang daladalang virus. Mas mainam pa rin na oobserbahan mo, i-isolate mo ang sarili mo para maiwasan mo yung makapanghawa o maitransmit yung infection dun sa ibang tao.
Quarantine versus isolation. What do they actually mean? We'll tell you more when we come back. You're watching Med Talk Health Talk on CNN Philippines. Today on Med Talk Health Talk, we're talking about testing, contact tracing, as well as quarantine and isolation. All of these steps are meant to help stop the spread of the virus. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines. People who have been in close contact with someone who has COVID-19 should undergo quarantine. Dr. Eileen, why quarantine and why 14 days?
This recommendation for a 14-day quarantine was based on the upper bounds of the COVID-19 incubation period. So we all know that the incubation period of COVID ranges from 2 to 14 days. So kaya in-establish that all COVID-19 contacts, ibig sabihin all persons who might have been exposed to COVID-19 who has no symptoms yet must voluntarily isolate or quarantine themselves away from other people.
How about some of the guidelines that say that 10 days, if 10 days without symptoms, then it is okay to push forward with a quarantine, or 7 days with a negative test? What's your opinion on this?
When we say, I think it has something to do with for those patients who are asymptomatic or who are mildly ill. So, ito yung mga pasyente na COVID positive test na walang sintomas o kaya yung symptoms nila ay mild. Ina-isolate sila, hinihiwalay sila for 10 days. In some other local government units, they do this for 14 days as well.
Once a person completes their isolation time allotted, that a repeat test or a repeat negative test is no longer required. Why is this so?
So if you can remember earlier days of the pandemic, yung requirement sa tao ay dapat 2 negative swab na test para lang makita na isasama na siya sa community or sa society. But then as Dr. Eileen has mentioned earlier on, kahit yung patay na virus, nadedetect pa rin ng katawan natin yung viral particles noon. So na-amplify to sa PCR natin, kaya makikita na positive at positive pa rin. Kahit hindi na nakakapanghawa yung isang tao na na nagkaroon ng COVID-19. Because basically in the general population, for those individuals who do not have immunocompromising condition, 10 days lang yung shedding ng virus. Ito yung panahon kung saan pwedeng makapanghawa yung isang tao. Ang pinaka-importante sa atin is makikita natin na yung sintomas ng pasyente ay nawala na-recover. Most especially wala ubo and lagnat. At yung pinaka-importante na titingnan natin ang mga sintomas bago natin ibalik ang isang tao sa komunidad o sa pamayanan.
A lot of information in today's episode, but all of those are important because we are all in this together. And with that, I'd like to thank our guests, public health physician Dr. Eileen Espina and infectious disease specialist Dr. Maria Rona Bergantin. Cases of COVID-19 remain high in our country. And if we look at the situation in India that has shocked the world, the latest wave of infections there is a combination of several factors: social behavior, inadequate healthcare system, or simply policy decisions. But other countries have been quite successful in containing the virus through masking, aggressive testing, and contact tracing. This should be a lesson to all of us. Remember, our actions will protect us and our loved ones as we get to the end of this very long tunnel. I'm Dr. Freddy Gomez. Thank you for watching MedTalk Health Talk only on CNN Philippines.